Thank you, and it's indeed an honor to be here. So when Arvind told me that, you need to speak about return on investment, by training, I'm a medical doctor, and doctors don't have any idea about return on investment. I think what they feel is that they invest too much time and get too less. So I said, let me put something together. So healthcare, don't you think this is one of the most peculiar industries we are in? Because it's in a perpetual crisis. So just when we thought we got rid of AIDS, we have Zika. So have you ever gone back from a conference and said, we've got healthcare sorted out, let's go somewhere else? It never happens, because healthcare is a perpetual con. By the time you have the answers, the questions actually change. It's very, very complex. It's got so institutionalized. I think the complexity in healthcare has got institutionalized. I'll give you just one example. You've all heard of ICD-10. In ICD-10, there's 70,000 ways you can get sick, hurt, or mortally injured. I'll give you some examples. There's a code for a parrot bite. There's a code for getting sucked into a jet engine. I love this one. It's Z63.1, problem with relation with in-laws. I think that's a pretty universal one. We all can relate to that. But this was strange, at Thanksgiving, some people pardon the turkey, but a lot of people get it on the table. So there are 9 codes, whether you were struck by a turkey, whether you were pecked. But most important, did it have any negative side effects? So that's how complex we made healthcare, But having made that so complex, when I was in the US, something really interesting happened. So this consultant was saying, in a hospital in Los Angeles, they got a patient, and he was sitting in the emergency, and no one was treating him. So he got really desperate. He said, sir, we can't find the code. You know what the code was? Getting hit by a drone, and that's not there. So they didn't know how to get it back from the insurance. So no matter how complex you make it, there's always one level beyond that. Healthcare is like, in a lot of ways, like a disease. Again, being a doctor, I relate to that. I think it's like diabetes. So, if one part of the ecosystem, which is the providers, the payers, the government, the pharma companies, or the medtech companies, if something goes wrong, it affects the whole ecosystem. So, in the 1990s and the 2000s, everybody was talking about the medtech companies, and they were the blue-eyed boys. They were the poster child. But today, medtech companies are in deep trouble because, for one reason, they were not able to innovate. And nobody was willing to pay for the incremental innovation they brought in. So there's this whole debate about bare metal stents. Are they as good as your bioabsorbable stents? So it was incremental innovation. So I think the same thing works for healthcare. Unless you really have the whole ecosystem up and working, it's like diabetes, which impacts every organ in the body. But I think a lot is changing. And I think the biggest change is, till now in healthcare, we have this concept of customer and consumer. Ultimately, you know who the customer in healthcare? It's the doctor. You don't prescribe an MRI. You just go and get it done. But the customer-consumer relationships, people don't believe it anymore. And that's what the change is. So 55% of patients trust the internet more than the doctor. And 75% want to move from informed consent to decision making. So 20 years ago, you went to your doctor. He said, you need to get surgery. You said, yes, doctor, I'll get admitted tomorrow. You know what happens today? You go, you tell the doctor, fine, if I want a second opinion. I want to know if I continue on medicines, what's going to happen. So Google's initial business model, they went to Yahoo and they of course tried to sell themselves to Yahoo, but they went to every company in Silicon Valley and they told them, we've got this great search engine. You subscribe to it for a year for only $100 and you can search anything in the world. They just got thrown out. Because they got thrown out, they changed their business model and that changed everything. Remember, if the service is free, you're the product. So business models, like I was saying, already are disrupting. There are many examples, but I'll give you something which is very, very relevant to healthcare. We've all heard of Uber. So the Uber model is based on the concept that the car is the least utilized asset. So there's a lot of free time my car has. It's lying in the garage. Can it be monetized? Now, Uber in the United States has gone one step ahead. Again, 20 years ago, we all remember, the doctor used to come home. Now what he does, he still comes home in New York for $250, but he comes in an Uber. The Uber business model is, there are a lot of doctors who have spare time, who are sitting at home, preparing for an exam. They're quite willing to go home. But they just don't want the hassle of the transport. So the Uber picks them up, takes it, he sees the patient, and he comes back home. So it's again a business model disruption. So are we ready for a hospital without patients? I mean, this is not futuristic. It's already happened. So Kaiser Permanente actually have a facility where every morning doctors, nurses, technicians walk in. But there are no patients. What do? Their whole value proposition is to ring up every patient and make sure that he never comes to a hospital. So that's the fundamental change. Today, the healthcare industry relies on a patient getting sick, coming to a hospital, and that's our business model. But the fundamental change in the business model of tomorrow is not, you don't gain from healthcare, you gain from health. And that's how things are changing. The other thing is, healthcare is very ripe for disruption. So if you look at, this is of course a US thing, it says the private providers are about 8.1 trillion. But look at that small 1.9 trillion. So that's the place where the whole disruption is going to happen. And the prediction is 10 years from now, the largest providers will not be the biggest healthcare companies. Today, you know, the Hospital Corporation of America with 33 billion is probably the largest private hospital. But I met someone in the HCA, and he says it's a matter of time before one of these technology companies overtake us. Very few people know that Walmart, both on services and products, their healthcare revenue is already $50 billion. So this is an interesting slide. You know, how would Jeff Bezos run a hospital? I just came about this thought because last year, many of you may have read, Jeff Bezos actually bought the Wall Street Journal. So Jeff Bezos is not a journalist. He doesn't have any passion for, journalism, despite, what's going on in the US today. But he was looking at it from a technology thing. So this is what he really said. He told them that build scale first, worry about profits later. Amazon is today profitable, nearly 20 years later. But it's built such an unbeatable scale that, it cannot be, it's unmatched, and there's a huge entry barrier. He said, expand the customer base. Why in a hospital the customer is only one who walks into your hospital? What about that child who's yet to be born, or that person sitting in bed at home? Why is he not a customer of the healthcare system? Know your customers. We know very little about our healthcare customers. Someone gets a cardiac surgery, goes back home, and that's period. If he comes back, that's fine. Build that database. Amazon in real time tells you when you go shopping, this is the book you should buy. This is something you need. Because it's analyzed. Not one healthcare company in India or abroad has done that. Secondly, news like healthcare is a perishable commodity. If you have the resources, you have the nurses, you have the doctors sitting here, why are you not using them? Maybe there's no patient in front, but they can be used virtually. So that model doesn't exist. And then he wants to obviously become a technology provider to the healthcare industry. So we hear a lot about innovation, and anywhere you go or anyone you meet, he says, okay, we'll innovate. So everyone's doing it, but really what works and what's scalable? I think that's the more important thing. Like I said, incremental innovation got the medtech companies into trouble. But I'll give you an example of what really I think is going to be the biggest innovation coming ahead. I think that's going to come in more from the artificial intelligence side. So when you go to doctors, and they will obviously tell you, healthcare won't work with artificial intelligence because you need three things. You need judgment, you need creativity, and empathy. But if you go and read the latest Harvard Business School article where they've done, it says 90% of the healthcare activities don't require these. They are just mundane processes. Again, in Kaiser Permanente, where I was last year, they looked at 1,000 X-rays which were there in the emergency. And these were read by very good doctors. But then they got them machine read. They found so many things had been missed. A patch had been missed. Apparent osteoporosis, where the spine was practically collapsing in an old lady, had never been reported. Machine learning is going to change that, because the machine basically would look at everything. It does not look. We humans are hardwired. We see what we look for. That doesn't work there. The second thing, again, which this article talks about, is the artificial intelligence fallacy. So most doctors say, if artificial intelligence was to actually replicate me, it must learn from me. That is wrong. The machine is more powerful. Today, if you look at the example of Watson, so today as a doctor, if I have to treat a patient, what knowledge do I have? I went to medical school, I did my MD, maybe I did my DM. I learned from my peers, I learned from the medical books and maybe the magazines, and that's my knowledge base. But Watson, what it gives you is when you see a patient in real time, it tells you 250,000 patients with the same condition. If you gave them 0.1 mg of dopamine versus 0.2, this would happen. So it really beats. That knowledge cannot even come over a lifetime. So I think the biggest change in innovation in healthcare is going to be the artificial intelligence piece. So let's come to the ROI, because Arvind's going to throw me out and say, you're talking everything but not talking the ROI. So yeah. So I think that's the main thing. And so two things. One is, what we really talk about in IT is a hard versus a soft ROI. So the hard is concrete numbers. I set up an IT system. This is the benefit it gives me. These are the quantifiable results I have. But I think the larger piece is the soft ROI. What are the tangible benefits for the staff? What are the tangible benefits for the patient? How has this brought about a transformation? How does this IT actually help me benchmark? And how does it actually create a culture which did not exist before? Because my people have access to all that information. And how does it finally impact the community? So people now are talking about the soft ROI rather than saying, okay, if I invested $1 million, I should have cost savings of 20%. So that's the fundamental change which has really happened. The second thing they're talking about in the ROI is ROI across the continuum of care. So today, if you look at the private healthcare providers, they just look at diagnostics, outpatient, emergency, the inpatient care. But what of the ROI on the extension, on preventive care, primary care, home health? What a huge ROI you would have if you could actually have the patient from the time he was born till the time he dies as part of your system. So that ROI has never been actually looked at. Then a lot of IT guys, and while I was at Apollo Hospitals, and I tell you, I was in Delhi, and one day I was told that, you're the IT manager. I said, I'm a doctor, I'm not, but they'd actually made me the IT manager at that stage. And so one of the doctors actually came to me and he told me, how come it is that everything is always a beta version? If there's any mistake, your guys come and tell me it's a beta version. So I told him, how long have you been here? So he said, 10 years. What have you been doing? Practicing. So I said, exactly, practicing. That's the beta version. We are not, at least we get into an alpha version, but doctors would never get perfect. So let's not blame the IT guys. So you got a rare condition called good health, and frankly, we're not very sure how to treat it. So doctors also don't know how to treat good health. So we are not very far off. So I think the best way to measure ROI, and this is from the HIMSS, is basically look at various things. The first part they say is look at satisfaction. And even before patient satisfaction, look at staff satisfaction, because that's going to translate into that. The second, look at how has treatment improved once you've actually put technology in. The third is the electronic data flow, how it makes and empowers everyone, including the nurses, which is very important. The P stands for prevention and patient education. And the final S is obviously the financial savings. If all these come together, then you have a proper ROI in healthcare. I was recently at Stanford, and this is very, very interesting. So one of the medical director actually told me, forget everything. What's been the biggest ROI for me? He was saying, over the last 5 years, today most doctors work over 100 hours. They're very, very stressed. So the words in healthcare are stress and burnout. They should be care and compassion. But he says this IT system has allowed my doctors, nurses to go home an hour early. That, I think, is the biggest ROI for me. Because I think as it's a high pressure system, can you actually relieve people of some of the work which a machine can do? And that brings out that actually is the biggest reason why you should actually invest on the IT side. So finally, what are the lessons we can learn? Push the hard ROI, document the soft ROI. Build clinical champions, because healthcare, again, you need the clinical champions. Establish a baseline. And this is a study which PwC actually did in the US. Hospitals which established a baseline before they put in any investment were far more successful. Report the outcomes to the leadership, because it needs top leadership. And don't be shy to showcase the results. Because obviously, you need an operational buy-in. So sometimes the IT folks are at the back, and they really don't tom-tom what they've done. And people think it's all the same. Go and tell them it's not the same. A lot has changed since we met last. So finally, I started with healthcare being a perpetual crisis. I think healthcare is a perpetual opportunity. What's transforming healthcare? I don't think we're transforming. Healthcare is getting disrupted. And who's a healthcare client? Everyone. With genomics, right from the time you're born to the time you die, you're going to be part of the healthcare system. So healthcare, ladies and gentlemen, I think gives us boundless opportunities in a borderless world. Thank you.